artificial intelligence and machine learning in embryo selection, evaluating the effectiveness and limitations of AI tools. The integration of artificial intelligence, AI, and machine learning, ML, into embryo selection has revolutionized the field of assisted reproductive technologies, ART, particularly in vitro fertilization, IVF. AI tools help clinicians predict embryo viability, which can significantly impact the chances of a successful pregnancy. These tools analyze large data sets of embryo images, genetic data, and clinical history to identify which embryos have the highest likelihood of implantation. However, while AI has shown promise in improving embryo selection, it also has certain limitations that need to be addressed. This section explores the effectiveness of AI and ML tools in embryo selection, as well as the limitations and challenges associated with their implementation. First, effectiveness of AI tools in embryo selection. A. Improve prediction of embryo viability. AI algorithms use large datasets to identify patterns in embryo morphology, developmental stages, and genetic information. This allows them to predict which embryos are more likely to result in a successful pregnancy. Machine learning models can analyze time-lapse imaging to track the growth of embryos over time and identify the best embryos for transfer based on specific features such as cleavage stage, blastocyst formation, and cell division patterns. Genetic data, when available, is integrated with morphological data to improve predictions, particularly in embryos with known genetic abnormalities. B. Increased accuracy in embryo grading. AI tools automatically grade embryos based on predefined criteria and images, ensuring objectivity and consistency. These systems reduce human error and subjectivity in embryo grading, leading to more reliable selection for embryo transfer. AI can evaluate more embryos and data points than a human embryologist, thus enhancing the comprehensiveness of the selection process. C. Enhanced efficiency in IVF. AI-driven tools allow for faster embryo evaluation, reducing the time required for embryo grading and selection. AI can help reduce the workload on embryologists, allowing them to focus on more complex aspects of RH procedures. By providing accurate predictions, AI can also minimize the number of embryos transferred, leading to fewer multiple pregnancies and associated risks. D. Personalization of treatment plans. AI can integrate patient-specific data such as age, hormonal levels, and reproductive history to create personalized embryo selection plans that enhance IVF success rates. This personalization helps RT clinicians make decisions that are best suited to the individual patient's needs, leading to more targeted and effective treatments. 2. Limitations of AI tools in embryo selection. A. Data quality and availability. AI systems require high-quality, large-scale datasets to function accurately. However, the quality of the data used to train AI models varies across clinics, leading to discrepancies in AI tool effectiveness. Incomplete or inconsistent data can lead to inaccurate embryo viability predictions. Low-resolution images or insufficient genetic data could affect the accuracy of AI's decision-making process. B. Lack of standardization. Embryo grading and selection protocols can vary widely between ART clinics. This lack of standardization across clinics can make it difficult to apply AI tools universally. AI systems trained on data from one clinic may perform poorly when applied to data from another clinic, limiting their generalizability. C. Limited integration with clinical decision making. AI models are designed to assist clinicians in decision making, but human oversight is still necessary. AI should not replace the embryologist. Instead, it should complement their expertise. There is a need for collaboration between AI systems and human embryologists to ensure clinical decisions are made based on a holistic view, considering both AI predictions and ethical considerations. D. Ethical and social considerations. Bias in data. AI models trained on biased or non-representative datasets may favor certain embryos based on age, ethnicity, or genetic background, leading to discriminatory practices in embryo selection. Ethical dilemmas. The use of AI in embryo selection raises ethical concerns about designer babies and embryo selection for non-medical reasons, such as selecting embryos based on sex or genetic traits unrelated to health. Data privacy. The use of patient data, particularly genetic data, for training AI models poses privacy risks. Ensuring that data is secure and used ethically is critical. Third, evaluating the effectiveness of AI in embryo selection. A. Clinical validation. Clinical studies and trials are necessary to assess the accuracy and efficacy of AI tools in predicting embryo viability. These studies should compare the success rates of AI-driven embryo selection versus traditional embryologist grading. Long-term studies are required to determine the impact of AI-based selection on pregnancy success rates, live birth rates, and multiple pregnancy rates. B. Impact on IVF success rates. AI has been shown to improve IVF outcomes by reducing the number of embryos transferred while still achieving high pregnancy success rates. The ability to predict embryo viability more accurately can also reduce the number of failed IVF cycles by selecting higher quality embryos for transfer. C. Integration with genetic testing. The integration of genetic testing, e.g. PGTA, PGTM, with AI-driven embryo selection can provide a more comprehensive approach to selecting embryos that are not only morally and physically viable, but also genetically healthy. Combining genetic data with morphological data in an AI algorithm improves the precision of selecting embryos most likely to lead to successful implantation. Fourth, future prospects and improvements. A. Continuous learning and algorithm improvement. AI models have the ability to learn and improve over time as they are exposed to more data and clinical outcomes. This means their predictions will continue to evolve and improve as more embryos are evaluated and studied. Longitudinal data from multiple clinics can be used to train more robust AI models, leading to better generalizability and accuracy. B. AI-assisted personalized medicine. In the future, AI could integrate with other technologies such as genetic testing and patient-specific health data to create fully personalized treatment plans for each ART patient, increasing the chances of success. C. Regulatory oversight and ethical guidelines. Ethical oversight and regulatory frameworks need to be in place to ensure that AI systems in ART adhere to ethical principles, such as patient autonomy, privacy, and non-discrimination. These frameworks should ensure that AI technologies are applied fairly and are continuously validated for clinical effectiveness. 5. Conclusion. AI and machine learning are becoming powerful tools in the embryo selection process, offering improved accuracy, efficiency, and personalization in RT treatments. However, challenges remain, including data quality, lack of standardization, and ethical concerns. As these tools evolve, they have the potential to significantly enhance IVF success rates and improve patient outcomes, provided that careful attention is given to data security, clinical validation, and ethical implications.